There's a new breast cancer treatment out recently approved by the FDA that could impact the future of cancer research. This is a new kind of medicine, they say, that helps people with this disease live longer, including one of our guests today. Breast cancer patient Ann Wertz joins us along with Dr. Robert Herman. Both played a part in the clinical trials for the new treatment. Dr. Herman, good morning to you.
Good morning to you.
And good morning to you also, Ann. Dr. Herman, let's start with you. What is the new, recently FDA-approved treatment? Tell us about that.
Well, the recently approved treatment is called Kadcyla. It's made by Genentech, who we are here on behalf of. It is a targeted treatment for HER2 metastatic breast cancer that has failed other treatments.
Now, how does it differ from some of the other treatments out there in the market now?
It is different in that it combines both an antibody therapy that is directed against the HER2 receptor of the HER2 positive breast cancer cells and a chemotherapy molecule that is attached to that antibody. The antibody binds to the HER2 receptor, is internalized into the cancer cells and releases the chemotherapy, which destroys the cancer cell while minimizing effects to the rest of the body.
All right, well, Ann, let's come to you now about your story. When were you diagnosed with breast cancer, and why did you decide to participate in a clinical trial? I know most people don't choose to go that route.
I was originally diagnosed in May of 2005. And then the metastatic diagnosis came in May of 2008. And I went on chemotherapy originally in 2005 and then again in 2008. And after the drug I was on, after my metastatic diagnosis failed, I had progression, I was offered a drug that I had known other people that had been on that had passed away. So I was looking for a drug that would keep me alive longer with a better quality of life.
Awesome. Now, what's your diagnosis?
So I went on the internet and I did my research.
Yes, and so it came back pretty favorable for you. You decided to get involved.
I'm sorry, I couldn't hear what you just said.
I said you were happy with what you read about and you decided to get involved with the clinical trial.
Right.
Yes. Okay. Well, Dr. Herman, how can people get more information about this?
There's a website that has information for patients. It's gene.com, GENE.com/patients.
And thank you so much for sharing your story. And Dr. Herman, thank you for joining us, both of you.
Thank you.
Thank you.
We'll be back in a moment. Stay with us.
This segment was sponsored by Genentech.